Hello, everyone. Urinary tract infection and how you can manage using Ayurveda therapy is the topic for this morning discussion. We're going to talk about this with Dr. Rajeshwari Nanaiah, who is an associate professor at Amrita School of Ayurveda in India. I am Amita from Nourish Talk, a global platform for natural and holistic therapies. I'd like to introduce all of you to Dr. Rajeshwari Nanaiah, who's joining us live from India. Welcome, Dr. Rajeshwari.
Thank you. It's good morning to all of you, and it's good evening from India.
Yes.
Okay. And shall I start?
Yes. Please start. Yes. Please start the topic.
Okay. Today I have come up with one more important topic, that is urinary tract infections, which is most common in women compared to men population, and it's a very painful and also most annoying, and also it has some serious consequences when it is spreading to the nearby structures. And even though it looks very simple, we need to treat it on right time so that it will not end up with any of the complications. So preferably when we consider urinary tract infections, it's mostly related to a female issues, or it's related to problems related to women, and hence I have concentrated this disease in today's presentation. Yes, next please. Okay, when we come across the disease urinary tract infections, we have few points to be considered, and the clients or we call patients or females will complain of few of very important clinical presentations. So in the beginning, they may just experience a persistent urge or increase in the frequency of micturition, what we call, or urination. And few will complain of burning sensation when urinating, and this frequency can increase. They'll go on and off to the washroom, but the quantity of urine which they pass will be very minimum. So these are the different kinds of presentations we will be getting from our clients. And when we examine the sample of urine, then the appearance of urine can be, it's very cloudy. This patient or a woman can identify by themselves, or a laboratory technician will identify this. And there will be a blood stains in the urine, and there is a change in the smell or in its odor. And most common symptom will be like lower abdominal pain. So when we visit such patients, or when we consult such clients, we'll get, these are the group of symptoms what I have listed. There may be one or two symptoms which is most prevalent in them and most disturbing all the time. It may be for a smaller duration of time, or it may be a chronic from 1 year, 1 month to, or it may be related to 2 months. Some episodes of infections they may report to us. Next, please. So there are few more points, important points to discuss and understand, and also we have to keep in our mind these are the possibilities, and why females are most prone to these conditions. And when we have a bedridden patient at our home, or when we are managing such cases, there are certain strategies we need to understand here. So let me go with a brief description related to these points. When we need to understand it is related to female anatomy. Why females are more prone than compared to males? It's because of the anatomical variation which is present in a female, that is shorter length of urethra. So she is very much prone for the infections compared to the male. So this is one of the anatomical what do you call it, the anatomical changes that is going to influence on this particular diseases. And next is, if a woman is in a fertile period and if she is active in social sexual activities, then also she is having a lot of chances related to the urinary tract infections. And we need to be cautious when she complains about recurrent infections. It may be once in a while, every female will be um, suffering from urinary tract infections, but it is not very serious. But if she is suffering repeatedly on and off, the episodes are relapsing in very short duration, like it may be in a 15 days to 1 month or 2 months. So such cases should be um, given more importance in terms of hygiene or in terms of food or medicines. It comes with the we need to assess why this lady is getting repeated infections. Is there any blockages? And usually, I'd say the blockages can happen with any of other inflammatory anomalies which might have happened before, or it may be because of urinary calculi or what we call renal calculi. So, such points we need to collect from our clients or females, and so that we can get into the diagnosis very properly, and our plan of advice and plan of management can be changed accordingly. Why it's so serious? Let me explain why this urinary tract infection has to be given more importance. Because initially it may look like a very simple disease, and we call it as an ascending infection. From the lower urinary tract, the infection can spread up to the other major structures. Which are the major structures? Means the bladder and kidney. So once the infection reaches up to there, if she is not diagnosed, if she is not properly managed, if she has not controlled her diet and other regimens, then she may lose her kidney. So it is a disease which is going to cause either acute or chronic kidney diseases, because as a sequelae of infections, the kidney and the cells of the renal parenchyma can damage. So this is a one important issue we have to discuss here. And if a patient is bedridden, then we have to ask about whether she is having or he is using a catheters. So such patients also will be suffering from urinary tract infections. This is not a single episode, they'll have multiple episodes or recurrence of conditions. Next is a urethral narrowing. A few females will come to us and they'll be telling that the stream of urine, or the flow of urine, what we call it, is not proper. It is not going, she's not having a complete evacuation feeling. So, this is what they'll tell in their own language. And so that we need to assess related with the recurrent infections. When you say about repeatedly, if she is suffering from urinary tract infections, the passage of urethra can get narrowed. So because once the inflammation is happening over and over a time period, it changes into a fibrotic changes. It's a normal physiology of the urinary tract or any structures in our body. So it undergoes a fibrosis. Fibrosis means it is a tubular structure, it is going to block. So such pathologies can happen. So the disease may look very simple, but there may be a lot of etiological or causative factors that we need to assess before giving our advice to the patients. Next comes this point is related to the chronic kidney disease or even to the acute kidney disease, that is sepsis. So it is a severe infection of the whole body can happen because of this particular urinary tract infection. It depends on which bacteria is affected. So it's a different stage and it is a complicatory stage of urinary tract infections. And we need to ask about their recent urinary treatment, whether they have undertaken any of the treatments related to the urinary tract. So such a group of symptoms or group of questions we need to ask them before we proceed with our understanding or the diagnosis, what we call, or whether before we give them some advices related to the medicine or to about their diet and regimens. So that's why I wanted to highlight this point. The disease may look very simple, but it will have some serious consequences. So the step-by-step monitoring of the patient is very much essential. Next comes these three are what I call it as a confusing statements or presentations given by our clients. And a female will be always suffering from a low back pain or a lower abdominal discomfort, or one more word I need to add here, that is stress incontinence. This is a medical terminology where they are telling about when she bends forward or when she coughs, there is this a minor leakage of urine from the urethra. So why this happens? This is all because it may not always associate with the major anatomical variations or the physiological changes or major any systemic illness. But the simple urinary tract infection will confuse us with these three clinical features. That's why I have highlighted. They won't, the most of them won't say that there is a burning micturition or there is a burning sensation or pain during the urination. They never say that, but they'll come to us by telling that there is a abdominal discomfort or there is a low back. Yeah, at about 60 to 70%. Hardly 20 to 30% will say about the burning sensation or the pain during urination. Okay,
So
next.
there can be confusion, right? In the sense like a client comes to you and they complain about low backache.
Yes, yes. I'll show you a case next. I
Okay,
have written
all right.
that.
Yes,
Yes.
absolutely.
This is you can see that clinical data heading is there in the upper portion of the reports. It is a history of lower abdominal pain. So she is not at all telling anything related to the urinary symptoms. She never told us related to any burning sensation, pain, or discomfort, or decrease in the quantity of urine, or increased in the frequency of urine. Only her problem was related to lower abdominal discomfort. It's not even pain also. But when we say about a lower abdominal pain or discomfort, we often suspect about the gynecological issues or gynec problems. But in this case, we did a urine analysis also, but it also didn't come much positive towards the urinary tract infection, and we gave the treatment related to the urinary tract infection. We consider it as a urinary tract infection and we started to treat, but the result was not so promising in early days. So I suggested let her go for a ultrasonography so that we can understand whether she's having any other illness related to the uterus or even to the cervix or ovaries. But when the result came, it was not related to the lower part of urinary tract, but it has already entered into the bladder. So we say that when it enters into the bladder, the infection is affecting the urinary bladder, then the symptoms will not be so much evident in most of the patients. So what happens it is symptoms will reduce only. The mucosa of urinary bladder will show some of the discomfort, and you can see that impression they have written it as multiple floating internal echoes. There is no evidence even related to the acute infections or active infections there. So
So what is the common test that one would do to diagnose that you have a urinary tract infection? Because it can be very confusing, right? For the
yeah, yes. Uh, Actually, we have the protocol is like urinary urine examination and ultrasonography is there.
yeah.
But most of the times, I would say that history taking will give us most a promising diagnostic tool compared to the other investigation procedures, because we may go wrong. This is a case where we had gone wrong with the simple urine analysis.
Yeah.
It was nothing, it was showing nothing, and we suspected it may be she may be having, because the area of pain which says about the underlying structure, that is also very important. So it goes very much towards clinical examination and how we interact and what are our questions to the patients. So that depends on that.
Okay. Should we
Okay.
move forward or do you want
Yes,
to stay?
yes, sure. We can go. See, this is a simple case where we can get it like urine. This lady come to us by telling that there is a burning micturition. It was not. She didn't had any fever or any other serious presentations. There is a slight discomfort during urination, and this bacteria is present, and that's what I have highlighted. And urine color and other changes are not much. Uh, giving It's not giving much of the points towards our diagnosis. Next, please. So in this urine blood, so whenever there is active infection, we can get this kind of presentations that there is a blood in the urine. It may be RBCs or it may be a frank blood, what we call the blood mixed with the urine. That also can happen. Hematuria, we call it as. And it is next is a urine mixed with the pus cells. So this is an absolute case of a urinary tract infection. This is how, if she is suffering from burning micturations and all, this is what we expect. This is a simple case. The patient will tell that there is a burning micturation and we'll go for a urine analysis and this will be the result. It's fine. It's a simple diagnosis can be made. But the previous one was quite confusing. So this is a what do you call a kind of different kinds of presentations they'll be giving to us, and we have to mostly we need to rely on examination compared to other investigations, particularly in urinary tract infections. And one would, in this case, one confusing point was she had pain during the intercourse. So this is uh, uh, a rare presentation what we are going to get. Not all females will suffer with this pain during intercourse. She used to tell it is so severe that she is unable to bear it and it lasts for few hours up to few days also. And later it is fine like that. So I cannot tell you the similar set of strategies will be present in all the cases or on all the claims. Each one will be showing a different presentations. So that is quite confusing and also quite challenging for the clinicians.
Sure, sure.
Next, please. So this is a general, what do you call, the preventive measures we need to adopt. We usually give them advices like have plenty of liquids. Normal water is sufficient, and if you are having too much of coffee and tea, then you need to have control over that, and you have to switch on to the normal water or tender coconut water or even into the fruit juices and all, because that we need to expel the metabolites from our body. So plenty of fluids are required to prevent the urinary tract infection. So it minimizes the concentration of urine. Usually when you take fluid, much more of the fluids, if there is any minor infections also, that gets washed off. So that's the principle behind giving plenty of liquids. But it should not be irritant like a coffee or tea or some aerated drinks or soft drinks, what we call, but it should be a plain water or medicated water or herbal waters. So that will be giving a good soothing effect over the urinary tracts. If you are traveling, if your food is not proper, if you are dehydrated, and if the temperature outside is too much, then you need to take care of your fluids. So that is the first instruction we need to give to our clients. Okay. Next, that comes to the hygiene. So the personal hygiene becomes the topmost priority in urinary tract infections. If hygiene is not maintained, this is one of the reasons in most of the females who is in the social who is having a low socioeconomic status. So such females will be having more number of episodes of urinary tract infections. And if we have a high socioeconomic status, there is also an issue that's related to the potentially irritating feminine products. They may be using a feminine products to keep them more hygienic, or it may be because of the hair removals. So many things are there, or creams or gels, whatever they are using. So such things, when they use, they need to be cautious, and after using, they need to wash it off very cleanly so that it will not retain in the skin, and it will enter, and it will irritate the urethra and cause the urinary any infections. So local infections can exaggerate the urinary tract infections. So such things we need to give them instructions. If they are next comes with the, if they are coming, they are taking any birth control methods like pills or diaphragms or even copper tea. So many available birth control methods are there. If they are using any one of them, then they are very susceptible for the urinary tract infection. So this also should be advised, or this point has to be given to the client, so that they'll be very cautious in the during the usage of such diaphragms or any other methods. So that's why that education or educating the female regarding her hygiene and personal care becomes the first priority in the prevention of urinary tract infections. Next, when it comes to Ayurveda, we have only two major understandings here. The main dosha, if we are considering dosha and managing the disease, then we have to consider Vata as in predominant dosha here, because it's the one which is drying up the urine, or it is the one which is um, bringing some changes in the concentration of the urines. And I don't say that it is Vata alone is having effect here, but there is a contribution of Pitta and Kapha also. If it is like, for example, if pain is is present in a female, then we call it as it is Vata Pradhana, or Vata is predominant. If burning sensation is predominant, then that condition is having a Pitta predominant symptoms. If there is a itchy or discharge is there, frequency is increased, then we will be considered about the Kapha Pradhana, or it is Kapha related symptoms. And the choice of drug or choice of the herbs will change according to the symptoms exhibited by the clients, or the symptoms which is most prevalent in them. So that's why it is like a permutation and combinations that we need to make when we advise the diet or the herbs. We need to list out the clinical symptom which is most predominant in the chronological order, and we have to prescribe the right medication or even the right diet for them. So they say that in the if we look into the text of Ayurveda, then we'll get few commonly used herbs, and I don't know whether these are available and feasible for the your clients there, because Tribulus Terrestris is one herb. It is widely used in southern parts of India. So um, every family, every member will be knowing about this herb, and
What is
they
the English name? What is the English name for this? The
it is
Tribulus?
called as Tribulus itself, and each country has a different names.
Okay.
This is a botanical name I have given here,
Okay.
and it is in Hindi they call it as Gokuru.
Okay. Okay.
Okay, and this is like it's present in everyone's home. Okay, so they'll just pluck few leaves and they'll boil it with warm water or plain water. Just they'll consume if they have any symptoms. It's like a household remedy, home remedy. It is prevalent everywhere. And in your country, you can opt for this raisins or vitis vinifera. What do you call grapes? Dry grapes. Okay,
Dry grapes. Okay.
yeah, black one is very good. You can soak in water, and overnight we can keep it. In the morning that you can squeeze and make it into a juice, and that you can dilute and consume by adding honey or adding a sugar if you need. Otherwise, by simple its juice can be consumed. So it has the best soothing effect ever you get from the what do you call from the kitchen. It is a medicine from the kitchen. Okay. Next is coconut water, tender coconut water, and it has almost all the electrolytes, and it will increase the urine output. And what if any infection is there in the lower part of urinary tract, that will be flushed out, and it will reduce burning micturition or burning urination instantaneously. So that is the beauty of that coconut water. And next is this is a medicinal, and also we can use in our daily food also, Emblica officinalis, or what we call amla. We have formulated some medicines out of this, and which can be given as a tea, or like a, you can hot infusions or cold infusions. And if we are taking this, even if the patient is having some bacteria in the urinary tract, like urine infection with the bacteria, no need of giving um, antibiotics if she doesn't have any fever or anything. No need to go for opting antibiotic therapy. They can just have this juice at home. Even dry powder will go, or raw juice is also fine. It is rich with the antioxidants. And if a female or a male, anyone, if they are having a vitamin A deficiency, we say that they'll be having normal tendency to the urinary tract infections, because there will be a lot of epithelial cells, we say dry cells will be there over the urinary tract, and it is becoming a culprit, or it is causing a urinary tract infection. So such cases are there, means it's the best antioxidant which we can advise to them. Simple amla powder, they can just 2 teaspoons, they can put in 1 glass of hot water, keep it for some time. They can filter that, and that superlatent liquid, they can take it once or twice in a day based on their severity of symptoms. So that is a best medicine, and also best diet they can include in their daily activities. And the same thing, if you are using a dry powder, then it is quite sour in taste. So you can mix with the jaggery or cane sugar. And if the quantity of urine is less, if the quantity of urine has reduced because of the excessive fluid loss, or the person is not taking much of the fluids, dehydrated, and burning sensation is there, and climatic changes is also there, whatever may be the causes, in such cases you can depend on barley. You may be knowing barley or all our millets. Okay, that millets gruel you can prepare, and they can take once in a day or twice in a day, and they along with their normal meal. And I would say that millets, rather than millets, barley is very much helpful for them. It is having that thin liquid can be extracted. When we boil it, you'll get a very thin liquid. It's like exactly like water. Okay, and that if a patient or if a person is drinking that, they'll be urinating in a large quantity. So whatever infections is there, burning sensation is there, stagnation is there, that will go off. So this is a primary remedies in can be done when we have initial or early conditions of urinary tract infections. And as I told earlier, vitamin A is having important role in almost all urinary and bladder infections. So have a check on carotene levels, and you need to have a food which is rich with the vitamin A, so that you will not be getting repeated episodes of urinary tract infections. If somebody is having or getting recurrent or repeated infection, they should have a look on their vitamin A, so that they'll have some dryness on the eyelids, and The skin will be scaly, so such features they can they can identify them, and they can modify with the food which is rich with the carotene, like papaya or carrot. Okay, all the orange fruits, what we call, is rich with the carotene. So that's about the herbs. So this is what.
I think that's an excellent presentation. Anything else you'd like to add, Dr. Nair?
And that this is we can categorize into a simple and a complicated one. If simple, these remedies will help to maximum extent, and if provided, if your diagnosis is very true, all our clients will be fine in a week or 10 days. And we need to understand that we have to educate them. That is very important to prevent the next further episodes of urinary tract infections. So this is what I wanted.
Okay, so what about some of the other commonly herbs that they're available here, like Triphala or Ashwagandha? You think they are helpful? I mean, Triphala is 3, right? Indian gooseberry is already part of Triphala.
Okay.
So
any local lesions, like I found that urinary in few conditions of urinary tract infections, they'll have itchy area, itchy vulva or itchy urinary part or the perineal part, what we say, and they'll have a discharge. And if if they are having like a white discharge or menorrhagia, such conditions and all, as a local hygienic liquid, we can use this Triphala as a kashaya. So that will give them a very good benefit. But it is, if you are giving in a burning sensation and all, it may not give much of the results. So better to go for another one herb is there, like Sariva. You might have heard of it. It is Hemidaspis indicus. Okay, so that herb is very good. Otherwise, we can use a Triphala. It is not a bad choice, but you may not get 100% benefit out of it. Yeah.
and what? Sorry, go ahead, please.
Yeah, Ashwagandha we can use it, and what I told in vitamin A deficiency, that we call it as a desquamation. One layer of urinary tract is just going off, peeling off because of nutritional deficiencies. Once along with the nutritional correction, you can add ashwagandha. So that is the best option.
Okay.
But it alone, it doesn't have a role here.
I see. It has to be added with the other.
Yeah. It can be given like a supplement, or it can be given as a supportive measures.
Got it. So let's talk. That's one more question on any of the Panchkarma therapies. Do you use that for urinary tract, or it's only lifestyle herbs and some of the other things that you talked about earlier?
No, it is most of the times it is related to the herbs itself. And if the infection is there in the bladder level, like what I showed in the ultrasound reports, if they are having some blood clots, that is, we call it as frank blood in the urine. In such cases, we can give a bladder wash. So other than that, no much of the Panchakarma is helpful here. And Panchakarma role comes when it is related with the chronic kidney disease conditions only. And if they are having some renal calculi issues, etc., at the time we can have a role. But in urinary tract, because any interventional therapies can increase the symptoms rather than decreasing the symptom. So, if possible, what you call the local soothing methods like sitz bath can be given as a local therapy. But no, any other Virechana may not help in such conditions. She may not be tolerable. Yeah. And other treatments are interventional, so that may aggravate the symptoms. So that may not be first line of management here.
So the main thing is the food, eating the right type of food and herbs.
Food, hygiene, and herbs.
Yeah. So, and then how much, I mean, in your opinion, you've done so many cases, but what is the approximate time your clients have taken to feel normal, I should say that, how much time does it take them?
Okay, if it is in the urinary tract, I mean, in the sense the lower part, if urethra itself, it has not come up to the bladder, it can
Yeah.
be relieved in 1 week to 2 weeks.
Okay.
If it
Okay.
is in a bladder level, it may take 1 more week or maximum 4 weeks. And everyone will are getting fine within 1 month. 30 days is a maximum time period I am allotting. Within that, they'll be fine.
That's very good. Then 2 to 4 weeks that you're able to get them to
Yeah.
reverse or get them to feel better.
Because
Oh,
they need these conditions need acute interventions. We have to think about the medicine which acts very fast, and we
yeah.
have to give it is very apt medications so that it
Yeah.
will not cause further damage, because we're not using any antibiotics here, so we have to be very swift in our action.
Correct. Correct. So most of the time when if a client will come, you would like you mentioned that a lot of times you take a very detailed case study or case taking, and you can find out if they have some kind of a thing. But in addition to that, do you always tell them to get some kind of a lab done? Like whether it's a blood count or it's a urine count, that goes in conjunction with the case taking.
Yeah, it goes with, because ours is a secondary care hospital, so we
Yes.
have the all facilities. So
Correct.
they few cases will come with the reports, and few may not come with the reports. And
Okay.
if we feel that it depends on the choice of the physician, so that whether he feels that this has to be investigated very soon, or
Yeah.
it can be taken to for about 7 days of time, we can wait for that period, so that depends on the choice of the clinician. So
Okay.
if I feel that he has to be intervened very fast, then we have to go for all the investigations in the first visit itself.
Yeah.
Otherwise, we can call them back after 5 days. So usually if it is not so severe, I'll call them back after 5 days.
Yeah.
If it is a very simple case, they'll be fine in few days, in 5 days itself.
Mm-hmm. Oh,
Okay,
okay.
so,
That's excellent. Excellent. Well,
uh,
thank you so much, Dr. Rajeshwari, for joining us again. I mean, your presentations are so amazing. I mean, they're to the point, they're very clear, and they tell the clients, exactly what you can do to prevent yourself. And also, if there is a complications, then, the doctors are there to help you in a natural way and using natural herbs, food as medicine. Before I wrap up, any last comments from you?
I'd say that the condition may look very simple, but don't neglect it. It
Yeah.
may we may what the time may come, like we have to pay a lot of mm, penalty for this. So
Yeah.
we have to be very cautious in every move. It depends. It's equally, both are equally important. Even the clinician and also the claims, both are equally important. I would say that prescribing medicine may be a option given to the clinician, but along with that, the clinician should understand that how to educate the patient or how to educate their claims. That part is very important. Even in both the diseases what I had presented, like
Yes.
urinary tract or maybe the reflux disease, the awareness or education to the claims is very important, equally important. So 50% benefit they may attain with the food or medicine, and 50% will be with the education related to their particular illness. So this should go in hand with all of our claims. So that will give maximum benefit.
Thank you. Thank you so much. With that, we'd like to end this session. Please share our sessions. Let us know your feedback, and share with your friends and family to help us spread the word of natural medicine. With that, thank you so much. Have a great day. Bye
Thank
now.
you. Thank you.
Thank